This winter season, and I don't know if it's the hormones postpartum that contributes to, but I definitely have been struggling more than usual with dandruff. And since many of you guys have been requesting a video on this topic, I thought it is time to make a video on dandruff or seborrheic dermatitis. So today I want to talk about what causes dandruff and how to best manage it at home if you're not able to get in to see a dermatologist. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. If you enjoy hair-related content, skincare-related content, then please give this video a thumbs up and consider subscribing to my YouTube channel. So dandruff, also known as seborrheic dermatitis medically, is a chronic inflammatory condition most commonly affecting the scalp, but can also affect other parts of our face and body. It's often characterized by the symptoms of itching, burning, and redness, along with flaking of the skin in the areas that's inflamed. Now, there is a whole spectrum of presentation where it can be just mild flaking all the way to really red, oozy, crusty scalp, along with thick, yellow, greasy scale. Now, dandruff is so common. We probably have all at some point in our life experienced dandruff, right? We see it in kids, and that is known as cradle cap. We see it in teenagers and adults, as well as elderly patients. And definitely as a dermatologist, this is one of the most common conditions that I treat. Now, I mentioned that it is a chronic inflammatory condition. What I mean by that is, like eczema, like psoriasis, there is no true cure. However, with the right medications, right treatments, it is very much manageable to the point where it's not visible nor is it bothersome symptomatically. So why does dandruff occur? Well, like most skin conditions, there's no one cause. It's multifactorial. We do know there are a few things that kind of all have to align together to cause dandruff. Number one, there's excessive sebum production. So you know how some people have more dry skin or oily skin? Well, you can have the same thing with your scalp. Some individuals, oil glands and the hair follicles just produce more oil. But having oily scalp doesn't always predispose you to having seborrheic dermatitis. There's also this component of yeast, Malassezia yeast, that we all have in our oil glands. And that's really important for the overall balance of our skin's microbiome. But for certain individuals, this yeast likes to overgrow and really love the sebum that the oil glands produce. But having excessive sebum and yeast is not enough. Everyone will respond to that yeast overgrowth a little differently. And for some individuals, they tend to generate more of an inflammatory response. So really, it's all of those components that have to align to really ultimately create that dandruff. And the other interesting but frustrating part is it can just almost show up one day suddenly. It's not unusual for me to see a patient in their late 20s, 30s, or even 40s for new onset of seborrheic dermatitis and expressing the frustration that they've never had this rash ever before in their life, and all of a sudden, bam, why is it occurring? Why me? Why now? And that is one enigma of skin we can't fully explain, but we do know that it's not just one thing. There is the internal factors as well as environmental triggers that can often bring out dandruff. So speaking of triggers, we do know that changes of season is a very common time for individuals to either experience new onset or worsening of their pre-existing dandruff, stress and sleep deprivation. And we also see dandruff more commonly occurring in individuals who are immunocompromised, whether that's HIV or AIDS, or individuals who take immunosuppressed medications for organ transplant, as well as individuals who have neurologic disease like dementia and Parkinson's. So obviously scalp is one of the most common sites for seborrheic dermatitis, but other parts of our face and body that are rich in sebaceous glands can also be affected, namely the face, between the eyebrows, folds of our nose, down the cheeks, inside, as well as behind our ears, the central chest, as well as armpits and groin folds. So if you've noticed subtle dryness around your nose or eyebrows that is not getting better with the moisturizer, you may have seborrheic dermatitis. Some individuals where it's really bad can even experience hair loss, but when it's on the body, on the skin, it can lead to post-inflammatory hyper or hypopigmentation. In fact, in skin of color individuals, I see this a ton in my clinic, they can just come in with a subtle loss of skin color. There's lightening of the skin around the eyebrows, around the nose, parts of their cheeks or frontal hairline. And that is seborrheic dermatitis. It can be very subtle. If you are experiencing that, or if you're having hair loss, then it is time to see a dermatologist because prescription medications are really going to be the most effective. Let's say you are noticing mild dandruff or can't get in to see a dermatologist right away. What are the things you can do at home? Anti-dandruff shampoos are really going to be the most effective for you treating dandruff at home. There are tons of anti-dandruff shampoos with different ingredients out there, including ketoconazole, zinc pyrithione, salicylic acid, selenium sulfite, and coal tar. And these all work similarly to a degree in fighting yeast, reducing oil, reducing the flaking, reducing the itching, and reducing the inflammation. So then you're probably asking, with so many ingredients, products, which one should I use? And how do I know it's going to be effective? Well, they all work well to a degree. And it kind of does become a little bit of trial and error in the sense you have to maybe use a couple to figure out which one works well for you and also works well for your hair. But in general, I like ketoconazole and zinc pyrithione. If you were to see a dermatologist for prescription medications, 2% ketoconazole is what I would prescribe, and 1% ketoconazole, also known as Nizoral, is what's available over the counter. I also like salicylic acid if you mostly have just flaking, but not so much itching or inflammation, because it can help to serve as an exfoliant in reducing the dry, flaky component of dandruff. And for individuals who have a lot of thick scale and itching, coal tar can be a really good option. But again, it's just that it doesn't smell good and it can be really drying on the hair. In general, these anti-dandruff shampoos can be drying. Now, if you do have dry hair, then certainly I recommend starting off with formulations that may be sulfate-free, as well as if you have color-treated hair, that's safe for color-treated hair. I actually recommend using zinc pyrithione formulations. Reasons being is that zinc pyrithione can easily be formulated with other conditioning ingredients, so the shampoo is less drying on your hair. You can check out brands like Head & Shoulder. They have various lines for different scalp and hair needs, as well as Dove has an anti-dandruff line of conditioner and shampoo that I find to be less drying on the hair. Two shampoos that I've been using for my color-treated dry hair is number one, the First Day Beauty Anti-Dandruff Shampoo with 1% zinc pyrithione. This is sulfate-free and is great for color-treated hair, as well as Neutrogena, their new scalp therapy line that contains various concentrations of salicylic acid. And this, again, is safe for color-treated hair as well. The other thing is, don't feel like you have to be loyal and stick to one ingredient. To be honest, the best way of using these anti-dandruff shampoos is to actually rotate through a couple different ones each time you wash your hair. So alternate maybe one day using ketoconazole, the next day using salicylic acid or zinc pyrithione. And that is really where you can hit all the aspects of that dandruff with different ingredients. I'm not going to talk about how frequently you should wash your hair because I feel like this topic deserves a video on its own. And it can be nuanced in the sense it's very individualized depending on your scalp and hair needs as well as your lifestyle. But if we're purely talking about treating dandruff, then in general, I recommend using the anti-dandruff shampoo about 3 to 4 times a week, and alternating between a couple ingredients each time you wash your hair is ideal. The other thing too is you want to give these ingredients enough contact time with your scalp to work. So that usually means massaging the shampoo onto your scalp and then leaving it on your scalp for about 5 minutes to let it work and then rinse off. And definitely you want to follow with a conditioner afterwards. Another trick I love telling my patients about is using the shampoo as a face or body wash. I'll often prescribe shampoo for the scalp, but also have patients while they're in the shower kind of lather it on their eyebrows or on their face or chest if they have seborrheic dermatitis in these areas as well. Now, there are certainly individuals who are not able to wash their hair that frequently or who shouldn't really be washing their hair that frequently. Those with curly, coily, and kinky hair at most should be washing their hair, once a week. If you have a lot of greasy hair and scale from the infrequent hair washing, oils can be a helpful way to remove that buildup. So mineral oil or even coconut oil has been shown to have some anti-yeast, antimicrobial properties, and massaging that onto your scalp to loosen the flakes and that buildup can be one way. But seeing a dermatologist if you're able to and getting a prescription medicated oil is really going to be the most effective. So I know this is a video mostly on home treatments and what you can do when you're not able to see a dermatologist, but I want to just share with you common prescription medications that a dermatologist would offer when you have severe and persistent dandruff that are really helpful, especially when you're not able to wash your hair as frequently and or you're not having improvements with the anti-dandruff shampoos at home. And these are products that I actually have a prescription for myself for my dandruff. So the first prescription is a topical steroid liquid that you can apply twice a day to areas of need. You can just put it on your finger and then massage it into your scalp or put it all over if you need to. I like the liquid formulation for most people because it's not as greasy. So for individuals who don't wash their hair every single day, you're not gonna have super greasy scalp when you use it. The only downside to it is that it can burn if you have like an open sore on your scalp. Otherwise, I find this to be really helpful. And this is kind of what I use in between hair washing. Another formulation that I absolutely love for kids with cradle cap and my skin of color patients who don't wash their hairs frequently is a medicated oil. This is fluocinolone oil and it comes in two different types, one for body, one for scalp, but literally they're the same thing. I love this because it's great for individuals who don't wash their hair as often, are more prone to getting that thick hair and scale buildup. It's nourishing for the scalp and it's not drying on the hair. So you can use it twice a day as you need to. But one way I love using this is to massage it on the night before you wash your hair, put it on where you need to, wear a shower cap over it. So that way when you do sleep with the oil in your scalp, it doesn't, stain your pillowcase. And that oil, what it does is it not only is it an anti-inflammatory, but also goes in to help to loosen up that thick hair and scale. So then the next morning when you're shampooing it off, comes off more readily. Now, if you do have seborrheic dermatitis on your face, in your ears, or on your body, you can also try hydrocortisone cream that's over the counter, especially if you're not having improvements with anti-dandruff shampoos. But here, I do recommend following up with the dermatologist once you start, just to make sure you're treating it appropriately to avoid any long-term side effects of the hydrocortisone cream on your skin. One last thing I just want to emphasize, because I get this question asked all the time on my social media, is that when it comes to severe dandruff, anti-dandruff treatments over the counter are not going to be enough. This is where you need to see a dermatologist for prescription medication, sometimes even oral medication. Also understand that dandruff will come and go, meaning there will be periods where you may have more flares than others. So when it's not working, is it just that it worked but it came back and that is just the nature of dandruff? Or is it because it's really severe and you need prescription medication? So just keep that in mind, guys, when you are treating dandruff. Is anti-dandruff shampoos can be helpful for mild cases, but when it's severe, you definitely need to see a dermatologist. All right, guys, so that's my quick video on how you can manage dandruff at home. Please let me know in the comments below, what is your favorite anti-dandruff shampoo? Because I really want to try them too. Again, I would love it if you can give this video a thumbs up and subscribe to my channel. I will talk to you guys next time. Bye.